Hello, my name is Nick Fisher, and I'm going to be talking about what I learned in Health Science 410, Issues in Aging, and how I will be applying what I learned in my future role as a healthcare provider. First off, I have to admit I never knew that elders were defined as being 65 and older. Next, I was shocked to find out that 4 out of 5 elders own their own homes. When I think about elders, I feel that the majority either live in assisted living complex or nursing homes. Next, I learned that elders who divorce is increasing and that baby boomers are the most educated. It was interesting to learn that the average life expectancy for men is 75, while women is 80. I knew smoking was the leading cause of preventable death, but I was shocked to find out that 13.2 years are lost for men that smoke and 14.5 years are lost for women that smoke. What's encouraging is that elders who quit gain 2 years back on their life expectancy. After watching the autopsy video, I learned that elders' skin is less elastic, they have a smaller liver, their eye lenses loses water, which is why most of them wear glasses, they have a 50% less metabolism, and they have thinner gray matter in their brain. I learned a lot in the speech of interior architect that Dr. Fernando gave. She explained that we need to create the environment like a home. With that said, we need to have both private and public spaces for them. We also need it to be safe and secure, along with an easy layout. When Carrie came to talk about assisted living complexes and nursing homes, I learned a lot. I never knew the differences and was mostly shocked about the prices. With RCACs, it costs around $1,500 to $3,000 a month, and staff checks up on you once a day. Now with the CBRF, there's a 24/7 staff, and it costs around $4,500 to $5,000 a month. Lastly, nursing homes are the most expensive at $6,000 to $7,000 a month, and they hold people with multiple chronic disabilities. Next, I was shocked about how much I learned when I did the interview paper with my grandma. She explained how living in a rural area gives them lots of barriers. Traveling to medical facility is their biggest barrier. Their normal doctor is 30 minutes away, and if they ever need to go to a larger facility, they have to drive at least an hour. Another barrier is technology. My grandma is on her computer almost every day, but she still explained frustration with it because she feels it's advancing way too fast and she can't keep up. I learned about how many medications she is taking and try to convince her to have a talk with her doctor to see if she can cut back on some. Finally, she explained that since she has non-drinking cirrhosis of the liver, the disease itself has put multiple limitations on her everyday living. During the class presentation, I learned a lot about health economics here in Stevens Point, from transportation to medical care to different health promotion programs. The YMCA does a great job offering health programs like the Lincoln Center In my future role as a healthcare provider, I will be able to apply a lot of what I learned. First off, I will advise patients that too many medications can be harmful. I will also promote health programs offered for elders, especially the Lincoln Center. If I work in an assisted living or nursing home complex, I will be respectful to the patient's space and try to make it as comfortable as possible. Next, I will inform patients about the limitations associated with living in a rural area. I will talk about my grandparents and what limitations they have dealing with. I also promote elders to quit smoking and inform them they can gain 2 years back on their life expectancy. Finally, I will educate elders and the others about difference with RCACs, CBRFs, and nursing homes. Thank you.